So we are launching this report, which is about the public health and fiscal impact of SSB tax in Nigeria. Nigerians should not forget that in 2021, the federal government imposed 10 naira fixed tax per litre of SSBs. When you look at the inflation rates and even the fact that the prices of these products have been going up, the corporations are revising the prices of these products since 2021, but the government tax still is fixed. That is, the tax is fixed. If you look at the inflation rate, it is normal for government in the fiscal year to also adjust that rate to inflation. That's number one. Number two is that we commissioned these economic studies that simulated what is the range, effective tax rate for SSBs in Nigeria. Don't forget that that tax is not just for government to earn revenue. It is to protect the Nigerian citizens. It is for public health. The tax is to ensure that there is decrease in the consumption of products that are causing NCDs in Nigeria. Products that causes diabetes, high blood pressure, and are also related to the cancers and the rest of them. And so you've got to introduce a tax that will induce reduction in consumption. What this report has shown us is that, first, it established the fact that SSB tax is the way to go to protect public health. And number two is that the least tax, the least rate per litre in Nigeria that will be of any effect at all is 130 naira per litre. And so we're doing this significantly why we think discussions about the Fiscal Act for 2024 is ongoing, so that the government can pick up this report and take appropriate action to protect the health of Nigerians. Don't forget that part of what we are saying is that this, a significant amount of this tax should be dedicated for public health. The consumption of these products causes very hard to manage diseases, and Nigerian citizens pay out of pocket. Now, if they live healthy lifestyle, they will not have some of these diseases we are talking about. That protects their economy. Number two, on the other side, is the government does not even have the revenue to spend on public health. And so by going this way, government again can also begin to earmark some of this money to fund access to health in Nigeria.
Sure.
One of the things we're looking at after this report is that we're going to be engaging all layers of government. We are engaging the state government. Hopefully we're going to be meeting with the Lagos State Ministry of Health. We're going to go to the states who are in the National Health Council, where all the health commissioners gathered. We're also at the National Assembly to look at a legislative pathway for funding public health through what is called SIM taxes. I mean, several countries around the world are looking at how to innovatively increase health budget, how to fund health. Health is extremely important in the life of any nation. So we are going to be engaging with the National Assembly. We are going to be engaging with all cadres of government, all levels of government, the Ministry of Finance, and most importantly, National Orientation Agency in terms of public awareness about the harmful effects of overconsumption of some of these products. So I have said that earlier, that when you hear the word taxes, people think that it's about inflicting pain on people. It's not really true. Basic economics tells us that taxes can be used as for behavioral change, so that you don't spend your money on what is unwholesome. So government then use that to mobilize resources and even attitudes and behavior towards what is good for the public, for you as a citizen, and for public health. So that's why this is actually very necessary at this point, so that Nigerians will spend their money on essential products and not products that will cause diseases that will again need more money to treat in the hospitals. And then government also will need more money actually to bring the health infrastructure. So this is extremely important. This is timely. This is the time for government to do this. This is something that has to do with the health of our people. And for us, this is the best time.